My name's Professor Stuart Taylor from the Centre of Medical Imaging at UCL. I'm an NIHR Senior Investigator. This project is about how we image the gut using MRI. The gut can be simplistically viewed as a long tube in the body, but in reality its function is extremely complex, governed by its own central nervous system as well as the body's nervous system and hormones. The gut can be affected by a whole host of diseases, both primarily and secondarily. For example, Crohn's disease is a common disease which affects the gut, causing thickening and abnormal strictures. Many systemic disorders such as Parkinson's and diabetes also have very profound effects on the gut. There's a whole host of patients who suffer from quite severe symptoms related to their gut, but with our current medical diagnostics, we're unable to find out exactly what is wrong with them. The gut is very hard to investigate, in part because of its deep anatomical location within the abdomen. For example, the current reference standards include manometric probes inserted into the gut, which is clearly invasive for the patient and also very expensive. In recent years, developments in MRI have really revolutionised how we examine the gut in clinical practice. With modern MR scanners and sequences, we can now get very good anatomical information about the structure of the gut. We're now moving towards whether we can measure function as well as structure. For example, at UCL, we've developed software which can quantify the peristaltic or motion activity of the gut, which is very important in a whole host of different diseases. There's a very large unmet clinical need in how we image and investigate the gut. With new MR techniques, we may be able to take our investigation further and look into the function of the gut. This PhD will concentrate on developing MR methods to take our research efforts forward. And I'll now pass over to Dr. David Atkinson, who will talk about the technical aspects of the project.
Hello, I'm David Atkinson. I've got a background in physics and computing, and I'm now a senior lecturer in the Centre for Medical Imaging in the UCL Division of Medicine. So in the engineering side of this project, we'd like to be able to improve the acquisition of data, the reconstruction of images, and the analysis or post-processing. So in the acquisition, we'd like to be able to make the data acquisition faster so that we can capture motion, and we'd like to be able to improve the resolution so that we can image small details. For example, the bowel wall is only a few millimetres thick in normals. So in image reconstruction, what we'd like to be able to do is use techniques from signal processing, such as compressed sensing, matrix completion, or theory about low-rank matrices, to enable us to undersample our data so that we can acquire it more rapidly or use the time to achieve a better spatial resolution. So it's quite unusual in this field for people to be able to publish in such high-impact journals as Nature, but recently another group has published a technique called MR fingerprinting, whereby they've undersampled their data, and from that they've been able to reconstruct many parameters related to the MR data. A recent PhD student has set up a spin-out company, and they've received a UCL Enterprise Bright Ideas Award